Welcome to the topic vitamins, minerals, and the nutritional supplements. So what are vitamins? These are the organic compounds which is required by the body in small amounts for the growth and for the maintenance of the normal metabolic processes. With the exception of vitamin D, the human cell cannot synthesize them, so they must be applied in the diet all the time. If a vitamin is not present in adequate amounts, the body's metabolism will be disrupted and disease will result. So very important to take the vitamins in the adequate amount, and the symptoms of the deficiency can be reversed by administrating of the missing vitamins. So vitamins are nothing but needed for the growth and the maintenance of the health. Vitamins are classified as the fat soluble or the water solubles. So if they're fat soluble, the factor A, it is more responsible towards ophthalmia, towards eye disorders if it's deficient. If it's a water soluble, so it is more towards the skin disorders. So these water soluble vitamins, they are absorbed along with the water in the digestive tract, and they are readily dissolving in the blood and the body fluids. For example, if we talk about, they cannot be stored for the later use, and they are excreted in the urine, must be ingested daily, and otherwise deficiencies will quickly develop. So we can see here in the picture, the water-soluble vitamins are the vitamin B or vitamin C, like citrus fruits, green peppers, strawberries, tomatoes, broccoli, sweet and white potatoes. They are the excellent food sources of the vitamin C ascorbic acid. So these examples that we have seen here. Then is the fat or the lipid-soluble vitamins. So fat or lipid, they cannot be absorbed because it's a fat in sufficient quantity in the small intestine unless they are ingested with other fat. They can be stored in large quantities in liver and fat, and the storage can lead to dangerously high levels of the fat-soluble vitamins if they are taken in excessive amounts. For example, vitamin D, vitamin E, and K. These are the fat-soluble vitamins. So the vitamin D, the body itself makes vitamin D when it is exposed to the sun. Other than that, the cheese, butter, margarine, fortified milk, fish, fortified cereals, these are also the good sources of the vitamin D. If we talk about vitamin K, it regulates the blood clotting via activation of the calcium binding proteins. They prevent the deposition of the calcium in arteries, so reduce the risk of heart attack. They regulate the blood sugar via the controlled synthesis of insulin. They reduce the risk of osteoporosis and the bone diseases and cancers. Vitamin E is very good for the skin, and we all get from these sources, like we can see the broccoli, the almonds, the lemon, the green leafy vegetables. These are all for the vitamin E. Now, the fat-soluble vitamins, they're also removed from the storage depots in the body as needed. Like for all the examples of fat-soluble are A, D, E, and K. So we already see the vitamin D, vitamin E, vitamin K. So there are the rich foods of vitamin K, avocado, green apples, green grapes, all the green things you can see, they are rich in vitamin K. And vitamin A is good for the eyes. So it has carrots, strawberries, all the red color more items, they are towards the vitamin A. Then dietary recommended allowances or RDA for the vitamins have been established for the average healthy adult. And the dietary recommended allowances or RDAs are based on scientific research on the humans and animals. Food and Nutrition Board of the National Academy of the Sciences, their established levels for the intake of vitamins and minerals, minimum amount of the vitamin or the mineral needed to prevent the deficiency in a healthy adult. They are revised periodically to reflect the latest scientific research. So this is the DRI or the RDA's recommendation. For vitamin A, the function is for the visual pigments, epithelial cells. For men, we need 3,000 international units, and for women, we need 2,333 international units. And its deficiency, the common causes, prolonged dietary deprivation, particularly when rice is the main food source. Pancreatic disease can occur, and cirrhosis, like the inflammation of the liver, can occur. Then is B complex, biotin B7, it's another name. The function is coenzyme in a metabolic reaction. The men, we need 30 mcg micrograms, and women is the same 30 micrograms. Their deficiencies are quite rare in the body. Cyanocobalamin, coenzyme in the nucleic acid metabolism. 2.4 mcg is required in both genders. Lack of intrinsic factor, that is B12. Inadequate intake of the food from the animal origin, which causes the deficiency of the vitamin B12. So vegetarians, they are mostly deficient of the vitamin B12. They have to take the vitamin B12. Then is folic acid or folates. It's B9, coenzyme in the amino acid and nucleic acid metabolism. We require 400 mcg for both the genders. And the common cause for deficiency is pregnancy, alcoholism, cancer, oral contraceptive uses. Then niacin B3, coenzyme in metabolic reactions, 16 required by men and the 14 milligram is required in the women. Prolonged dietary deprivation, particularly when Indian corn or the maize or the millet is your main food source and you're not taking more foods other than that. Then you can have chronic diarrhea, it causes it, or the liver disease and alcoholism causes B3 deficiency. Then is pantothenic acid B5, it's coenzyme in metabolic reactions. Both requires 5 milligrams and the deficiencies are rare. B6, pyridoxine, it's again a coenzyme in amino acid metabolism. We require 1.3 milligram. Common cause is the alcoholism, oral contraceptive uses, and the malabsorption diseases. Then riboflavin B2, again coenzyme in metabolic reactions. The requirement is here, and the inadequate consumption of the milk or animal products. Chronic diarrhea leads to this disease, and the liver disease or alcoholism. Then is thiamine B1, coenzyme in the metabolic reactions. Prolonged dietary deprivation, particularly again when the rice is the main food source, hyperthyroidism, pregnancy, liver disease, and alcoholism. Vitamin C, coenzyme and antioxidant. Inadequate intake of the fruits and vegetables, pregnancy, chronic inflammatory disease, burns, diarrhea, and alcoholism. Vitamin D, its main function is for calcium and phosphate metabolism. We need 600 IU for men and women. It is because of we take the low dietary intake, inadequate exposure to the sunlight. Vitamin E, antioxidant, premature infants, malabsorption diseases. K is cofactor in blood clotting. Newborns, they have it, liver disease, long-term parenteral nutrition. Parenteral nutrition, certain drugs such as the cephalosporins and the salicylates. Now, the vitamin therapy is indicated for specific conditions, like if the hypervitaminosis occurs, which is called as hyper. Hyper means more or toxic levels of the vitamins in your body. If you are taking too much and then you don't need it. Vitamin A, C, D, E, B6, niacin, and folic acid especially. In Canada, it is more common to observe syndromes of the vitamin excess than those of the vitamin deficiency. Most patients are unaware that taking too much of the vitamin or the mineral can cause the serious adverse effects also. The deficiency of the vitamin B12, it's one of the most common and clinically important vitamin syndromes. Pernicious anemia or megaloblastic anemia. It occurs with the deficiency of vitamin B12. Creates a lack of the activated folic acid, and it is essential for the DNA synthesis and cell division. This B12 deficiency also affects the nervous system. It causes the tingling or numbness in the limbs, mood disturbances, and hallucinations in severe deficiencies. Vitamin B12 should be administered parenterally, IM intramuscularly, or SC subcutaneously for adequate absorption. B12 deficiency, actually it is metabolized like this. When we take the dietary vitamin B12, then it goes in the body. It's a free B12. It is converted into the IF with the help of taking the parietal cells of the stomach, IF, then this B12 is going into the intestines, into the ileum. If from the ileum, then B12 can be absorbed only in last 60 centimeter of the small intestine, that is an ileum. Other than that, it goes to the blood vessels over here, and from the blood vessels, it goes to growing cells, or it gets to the storage for the liver. So B12 is stored in the liver. 3 to 5 years of the supply is being stored in the liver, and it's excreted to the bile, again, recycling back to the body. That is how the B12 is working in metabolizing in the body. Next comes to the minerals. So minerals are nothing but the inorganic substances needed in very small amounts to maintain the normal body temperature. When we say the minerals includes like the potassium, magnesium, iron, zinc, selenium, calcium, phosphorus. So we can see all the fruits. The fruits gives us vitamin C, vitamin A, and folic acid, but also gives potassium. Vegetables gives potassium and magnesium. Proteins gives iron, zinc, and magnesium. Grains gives you iron, magnesium, and selenium. And dairy products gives you the calcium, potassium, and the phosphorus like that. The minerals, we say them as the dietary minerals have the macromolecules and the trace macro minerals and the trace minerals. So these pink colored, they are all the macro minerals. Macro means we need in more amount, like hydrogen, sodium, magnesium, potassium, calcium, carbon, nitrogen, oxygen, phosphorus, sulfur, chlorine, and iron. And the rest, all color, that is the trace minerals that we need them in a very small amount. So bone salts, calcium and phosphorus, trace, these are the macro minerals which are required for making our bones. They make up to 75% of the total mineral content in the body. And these minerals are classified as the major minerals, that is macro minerals or the trace minerals. Next is important and diverse functions of in the body is sodium and magnesium. They appear primarily as ions in the body fluids. And iron and cobalt, they are usually found you're usually bound to the organic molecules. So they are showing us an example of magnesium-rich food. We can see all the green vegetables, avocados, and the oatmeals. We are seeing the iron, which is rich in iron. Here we can see the sodium is the salt, and this is the cobalt diet. That is artichokes, your lobsters, your lemon, your meat, they have the cobalt in it. Now minerals, how much we need? Calcium, we need 1000 milligrams. The trace minerals is chromium, we need 0.052 milligram. Then all these are the macro minerals, calcium, chloride, magnesium, phosphorus, and potassium. We can see from here that how much we need every day in our diet. And the micro or the trace minerals are the chromium, cobalt, copper, fluoride, and iodide. Again, the sodium and sulfur are the macro, iron, magnesium, molybdenum, selenium, and zinc. These are the trace minerals. Then comes to the third part is the enteral and the total parenteral nutrition. These are the therapies that deliver the essential nutrients to the patients with deficiencies of these kind of the vitamins and minerals. They can't take it from mouth. They're really deficient, then we have to give via their blood. So causes of undernutrition, advanced age, HIV/AIDS, alcoholism, severe burns, cancer, chronic inflammatory bowel disease, and eating disorders. So enteral nutrition, these are the products which is administered via GI tract orally or through a feeding tube. We do the oral feeding, which allows the natural digestive processes to occur and requires less nursing care. And the tube feeding is necessary when the patient has difficulty swallowing or is otherwise unable to take the meals orally. An advantage of this tube feeding is that the amount of the enteral nutrition the patient is receiving can be precisely measured and recorded. And enteral product can also be specific to address the nutritional needs, amino acids, proteins, carbohydrates, or fats. Then TPNs, total parenteral nutrition. The metabolic needs of the patient are unable to be met through the enteral nutrition. Short-term therapy or peripheral vein TPN may be used. Long-term therapy often requires the central vein TPN. They provides all the patient's nutritional needs with the solutions containing amino acids, fats, carbohydrates, as dextrose, electrolytes, vitamins, and minerals. They're specific to disease state, renal or hepatic failure, and nutrition can be precisely monitored. So these are all the minerals and the vitamins that we require for our body. Fat-soluble vitamins, tocopherol, vitamin E, cholecalciferol, vitamin D3, ergocalciferol, vitamin D2, and phytonadione, vitamin K, retinol, beta-carotene, vitamin A. Macro minerals, calcium acetate, carbonate, citrate, lactate. Then we have ferrous fumarate, glutamate, sulfate. Magnesium salts comes in the chloride, hydroxide, oxide, sulfate. Potassium chloride, potassium sodium phosphate combination, sodium bicarbonates. Microminerals are the zinc sulfate, which is required for the skin. Water-soluble vitamins like ascorbic acid, vitamin C, biotin, vitamin B7, cyanocobalamin, B12, niacin, nicotinic acid, or niacinamide, any name we can call them, B3, pantothenic acid, B5, pyridoxine, B6, riboflavin, B2, and thiamine, B1. So this is summarized as all the vitamins, fat, or the water-soluble, they are required to promote the health and growth. RDA's recommendations for the vitamins are established for the health adult for a specific conditions. Minerals and inorganic substances are also required for the daily living, but in small quantities. So all the essential nutrients can be provided entirely or parenterally, depending on the person's underlying health condition. That's all. Thanks for watching.